What is glycine? Is it genuinely effective? Does it truly help? Can it really deliver the desired results? Today we will attempt to comprehend this medication. Have a good day, dear viewers. Welcome to my channel. Newcomers, let me introduce myself. I'm Marat Valeev, a cardiologist, and on our channel we have discussions about the most relevant medical topics in the simplest and most easily understandable language. Today we will talk about wisteria. What is glycine? Glycine is a non-essential amino acid that is present in many proteins and protein structures. This is a break neurometal that performs a wide range of biochemical functions in the human body. It is essential for various physiological processes and is involved in numerous biochemical reactions. However, today we will discuss glycine as a medication. Therefore, if you visit the pharmacy and request the medication glycine, they will provide it to you. Indeed, it is registered as a medicinal product. If we talk about glycine as a medicinal product, then it, as a clinico-pharmacological group, belongs to drugs that improve the metabolism of the brain. That is, it is a metabolic agent. What does it say? This implies that it is as if glycine enhances the nutrition of our brain, providing beneficial effects on brain function and health. Now we will determine it. Is it truly so? Prior to commencing to comprehend the function of glycine in general, I would like to briefly discuss biochemistry and grasp that glycine, as an amino acid, is unable to pass through the blood-brain barrier because of its properties. What is the message conveyed? This implies that the blood clot is incapable of reaching the brain due to certain factors. The body in and of itself has the ability to regulate the intake and release of glycine, a crucial amino acid. And even if you consume a significant amount of glycine, it does not necessarily imply that all of it will enter the brain and everything will be in a satisfactory condition or state of well-being. Because if you read the instructions for use, here I specifically opened the computer now, and we see that there are simply a huge number of indications for the use of this drug. Stressful situations, psycho-emotional tensions, conflict situations, decrease in oral performance, ninth behavior of children and adolescents, organic diseases of nervous system, ischemic strokes, traumatic brain injuries, neuroses in a water state, glycine dystonia syndrome, narcology as a medicinal product that enhances mental performance, and so on and so on. So you begin reading the medication and comprehend that glycine is a miraculous drug, likely something that everyone should take, because everything listed here in one way or another we have all experienced with you at some stage. In some stressful situations, when experiencing mental strain, you may find yourself involuntarily questioning whether this drug is truly effective and if it genuinely works. I can provide you with an absolute assurance that at this present moment in time, there are no serious clinical double-blind placebo-controlled studies specifically related to glycine in existence or being conducted. However, that does not imply that glycine is ineffective. This is never the case. The reality is that currently, there is a lack of substantial and credible evidence to support its efficacy. Therefore, it is not included in clinical guidelines. However, a significant amount of research is being conducted on glycine. I will leave you a link to a serious study. We studied a group of patients who were already elderly. They studied them, if I'm not wrong, for around 2 years, giving them glycine and NAC, an amino acid preparation. They were given in combination for a span of 2 years and carefully observed, thereby examining a multitude of indicators in these patients. The researchers found that by the age of almost 30, certain mental abilities and the overall function of the nervous system in these individuals showed significant improvement and enhancement. It's hard to say how reliable it is at the moment, but I repeat, several such studies are already being conducted and have been conducted. And indeed, glycine, specifically with N-acetylcysteine, in terms of IT aging, that is, in terms of such aging, it proves its effectiveness in some studies. However, I must reiterate once again that the research of exactly such seriousness, which is conducted in double so-called placebo-controlled studies, is of utmost importance and should not be underestimated. They do not have them yet. We do not know what it will be like in 2, 5, 10 years, but right now we have this picture with you. As for the dosages, here of course everything is individual. In general, it is quite difficult to overdose on medications. Even if a person drinks the whole package, nothing will happen. This doesn't mean you need to take it now, experiment with it. In any case, you need to follow the instructions. But I say again, such a drug as glycine is generally a safe and harmless remedy. Thus, maybe the placebo effect cannot be excluded in this case. If you consume glycine and it provides benefits, I believe it is merely an advantage. I do not perceive any issues with accepting it. I find no faults in agreeing to it. I took it myself a couple of years ago and, as it seemed to me, felt the effect. Therefore, this placebo effect cannot be excluded again. So, if you accept it and it assists you, I do not think there is anything incorrect with that. Continue taking. If you consume it and realize that it is a dummy, discard it and completely disregard this medication for all eternity. However, in my opinion, in certain situations like traumatic brain injuries, birth injuries in children and adolescents, and some conditions related to brain damage, I believe that the use of glycine might be indicated and appropriate. This is because it is possible that the blood-brain barrier is damaged in these cases, and as a result, glycine could potentially have access to the brain itself. Therefore, considering glycine as a treatment option in such scenarios could be beneficial in facilitating its delivery to the affected areas of the brain. But these are just guesses. Anyway, he is indicated for head injuries, as we saw in the instructions. Therefore, I repeat once again, here everything is individual. If you accept and help, great. You must leave and accept additionally. If not, forget it and refrain from using this medication any longer. As for contraindications, he does not have any serious contraindications except for some allergic reactions and individual intolerance to this medication. This drug is also not recommended for pregnant and lactating women, because studies on pregnant and lactating women are strictly prohibited. So practically all drugs state that the drug is contraindicated during pregnancy and breastfeeding. Here is such a small informative video. Ask questions, leave comments, and most importantly, stay healthy. Goodbye.